The more unequal the society, the higher the suicide rate. Introduction. Social inequality has long been a subject of concern among sociologists, economists, and policymakers. The disparities in wealth, access to resources, and opportunities create not only economic hardships but also profound psychological distress. One of the most tragic and overlooked consequences of social inequality is its correlation with suicide rates. Numerous studies indicate that societies with greater income and social disparities tend to have higher suicide rates. This essay explores how economic inequality contributes to suicide by increasing stress, fostering social alienation, reducing access to mental health services, and exacerbating feelings of hopelessness. Through theoretical frameworks, statistical analyses, and real-world case studies, we will examine why and how inequality and suicide are interconnected. Theoretical perspectives on inequality and suicide. Sociologists and psychologists have long studied the relationship between social structures and self-destructive behaviors. One of the most influential theories in this domain is Emil Durkheim's theory of suicide. Durkheim categorized suicide into 4 types, but for the purpose of this discussion, 2 are particularly relevant: anomic suicide and egoistic suicide. Anomic suicide occurs when societal instability, often brought about by economic upheavals, leaves individuals without a sense of purpose or direction. Societies experiencing rapid economic changes, whether through sudden prosperity or financial crises, see spikes in suicide rates. This is because individuals who cannot adapt to new economic structures experience extreme psychological distress. Egoistic suicide results from a lack of social integration. When individuals feel isolated due to economic disparities, they experience greater feelings of insignificance and despair. Societies with extreme wealth gaps often have lower levels of social cohesion, leading to higher suicide rates among those who feel left behind. Building on Durkheim, modern researchers such as Richard Wilkinson and Kate Pickett argue in The Spirit Level that economic inequality fosters a society of heightened stress, status anxiety, and reduced social trust, all of which are significant risk factors for suicide. Statistical evidence linking inequality and suicide rates. Empirical research consistently demonstrates a correlation between high levels of inequality and increased suicide rates. Consider the following statistics. A study published in The Lancet found that a 1% increase in income inequality, measured by the Gini coefficient, was associated with a 0.8% increase in suicide rates in high-income countries. The United States, one of the most unequal developed nations, has seen rising suicide rates parallel to growing income disparities over the last 4 decades. Nordic countries, known for their relatively equal wealth distribution, have significantly lower suicide rates compared to highly unequal nations such as Russia and the United States. In Japan and South Korea, economic competition and job insecurity, exacerbated by inequality, have contributed to some of the highest suicide rates among developed nations. Mechanisms through which inequality drives suicide. 1. Increased psychological stress and mental health deterioration. Economic inequality creates an environment where those at the lower end of the socioeconomic spectrum experience chronic stress due to financial instability, job insecurity, and social comparison. The pressure to meet societal expectations while lacking the means to do so leads to chronic anxiety and depression. Stress-related illnesses, including mental health disorders, disproportionately affect individuals in low-income groups. 2. Social alienation and erosion of community bonds. As income gaps widen, the social fabric of communities weakens. People in highly unequal societies report lower levels of trust in others, which reduces communal support networks. Loneliness and social isolation, both strong predictors of suicide, are more prevalent in societies where economic divides create stark differences in lifestyles and access to opportunities. 3. Reduced access to mental health care. Healthcare inequality means that those most vulnerable to suicide, often low-income individuals, have the least access to mental health services. The high costs of therapy, medication, and psychiatric care create barriers that prevent effective intervention. Countries with universal healthcare systems tend to have lower suicide rates, as mental health services are more accessible. 4. Feelings of hopelessness and despair. When upward mobility is limited and economic disparities widen, people feel trapped in their socioeconomic conditions. The lack of prospects for a better future fosters a sense of hopelessness, which is one of the strongest psychological predictors of suicide. The idea that one's situation is unchangeable increases the likelihood of individuals resorting to self-harm as an escape. Case studies of inequality-driven suicide crises. The United States, rising suicides in an increasingly unequal society. Since the 1980s, the U.S. has experienced growing income inequality alongside rising suicide rates. The opioid crisis, job losses due to automation and outsourcing, and the weakening of social safety nets have all contributed to a mental health crisis among lower-income populations. Working-class men, particularly in rural areas, have seen some of the highest increases in suicide rates, correlating with economic decline and social alienation. South Korea, the high cost of success. South Korea, despite its economic prosperity, has one of the highest suicide rates in the world. The intense societal pressure to succeed, coupled with job insecurity and inequality, has created a mental health crisis. The elderly, who often lack financial security due to inadequate social welfare, and young people, who face extreme academic and career pressures, are particularly vulnerable. Russia, economic collapse and suicide. Following the collapse of the Soviet Union, Russia saw an unprecedented rise in economic inequality and a corresponding spike in suicide rates. The rapid privatization of industries led to widespread unemployment and poverty, causing despair among millions. Suicide rates in Russia remain significantly high, particularly among middle-aged men who struggle with economic hardship and social dislocation. Policy solutions to reduce suicide rates by addressing inequality. Given the clear link between economic disparity and suicide, addressing inequality can be a crucial strategy in suicide prevention. Potential policy solutions include progressive taxation and wealth redistribution. Implementing fairer tax policies can reduce income inequality, giving lower-income populations better economic stability and access to resources. Universal healthcare with strong mental health support. Ensuring that mental health services are accessible to all citizens can help prevent suicides by providing necessary interventions before crises occur. Strengthening social safety nets. Policies such as universal basic income, affordable housing, and employment programs can reduce economic stress and increase overall well-being. Community engagement programs. Encouraging local community support networks can foster social cohesion, reducing feelings of isolation and alienation. Workplace reforms and reduced job insecurity. Policies promoting fair wages, job security, and work-life balance can alleviate economic stress and improve mental health outcomes. Conclusion. The correlation between social inequality and suicide is undeniable. As societies become more unequal, individuals experience higher levels of stress, alienation, and despair, leading to increased suicide rates. Addressing economic inequality is not just a matter of financial fairness, it is a critical public health issue. By implementing policies that promote economic stability, access to mental health care, and social cohesion, societies can reduce the tragic consequences of inequality and build a healthier, more inclusive future. Understanding and addressing the link between inequality and suicide is essential for creating a world where economic status does not determine one's likelihood of survival.